showing how to respond to an adult who's bleeding. Lesson 6, emergency care and prevention. Today we were doing a scenario. You hear a coworker shout in pain. You stop what you're doing and you go to investigate. The equipment you'll need today is latex gloves. Got my gloves right here. I do not have any gauze. I do not have any gauze pads or roller gauze, so I do have to improvise. This will be my gauze pad for today. Nice little handkerchief. And my roller gauze has to be this tie. I'm so sorry, but I think it will do kind of the same thing, so I hope it works. But setup. The injured person is sitting in a chair or on the ground. So today, my injured person happens to be my pillow. You're on the ground. And first off, always scenario checklist. You got to size up the scene. You got to form initial impressions. You enter the scene. Is the scene safe to enter? You don't know if the scene is safe to enter. You don't, because all you did was hear a coworker shout. They weren't with you. They weren't near you. Well, they were close enough for you to hear and respond, but they aren't an eye, visible eye, whatever. You can't see them. And you just don't know. You don't know who yelled, for instance. You don't even know what coworker, maybe man or woman. You don't know. So you gotta stop what you're doing to go see what happened. So you call out, "Are you okay? What happened?" If you get a response, great. "Are you okay? What happened?" He might respond, he might not. You wait to hear. If you hear more than one voice, then you might look for someone to say, "I'm over here," or "I'm hurt," or someone might even say, "Don't come." But in this case, if they say, "I'm over here, I'm hurt," you go. You be cautious because you still don't know what happened. Once you make sure everything around you is okay, you try to see how many people were involved. If the adult is who is bleeding, if the adult is bleeding and they say, "I cut myself," or something along those lines, something made them bleed. So if they give you the reason and you deem it okay to help them, and you know how many people were involved, they tell you, "Oh, it's just me. I just cut myself." Maybe you work in a warehouse, they cut themselves cutting something. But you ask them how many people, initial impression of the nature of the illness. You don't know what the person may have. There's some things where some people may have certain conditions like hepatitis C or HIV or AIDS, and you may not be able to touch their blood with your bare hands. So you have to ask for certain things like that. Or maybe they even have a chronic illness. They battle with hemophilia and their platelets don't work the same, so they bleed out uncontrollably. You have to be aware of their medical conditions. If they can't respond, that's when you proceed with caution. If they can't respond, they tell you, "I'm fine. I don't have any medical conditions. I'm not hemophiliac. I'm not diabetic. I'm not anything. You're okay." That's it. You see what the issue is. Oh gosh. And then if the bleeding, sorry. Is anyone else available to help? That's what was next. In that case, you would just see if you are the only person that responded to the shout for help or to the shouting. In that case, you would actually call 911 yourself, because there's no one else to tell. Call 911. If someone else heard the shout too and they come at the same time as you, that's when you say, "Go get me the AED kit, the first aid kit, and call 911. You point, you make sure you're inflecting your voice, you make sure they hear you, you're pronunciating. You don't have time to really ask where or what do you need again, because someone needs help. It's right now. So make sure you point, you be clear, you tell them, and after that, use the appropriate PPE. So we always need gloves. Always need gloves. Actually, before anything, you always, like, you could still tell the whatever, someone who's around, go get the first aid kit, the AD, whatever they need, call 911. But first, before you yourself check the person, you must ask. Not even ask. You have to make sure there is consent. You have to make sure they consent to being helped, because some people may not want to be helped. So you tell a person your name. Hi, my name is Jason Conrad. In this case, person's on the floor bleeding. I can see that. Hi, my name is Jason Conrad. I'm a beginner in emergency care, CPR certified, first aid certified. You would tell them, you ask them, would you like some help? Can I help you? If they say yes, or they give you some type of sign saying yes, that's when you proceed. If they're not really responding and you can see that, and you see the blood, you see them losing too much, that's when you kind of got to make the judgment call, and that's when you do help them. So you would go ahead with putting on your gloves. Fresh pair of gloves always. Oh, sorry about that. Jesus Christ. Oh, you're gonna tell me they want to go right now. Perfect. Sorry, sweaty hands. Okay. Perfect. Alright, as good as this is gonna get. Alright. You would put this one on, same way. Make sure they're fresh and clean. Don't want to contaminate anything. So, first, you would tell, we went through that, tell a person your name. You would put, with the, when you see the wound, you're going to put direct pressure on it from wherever they're bleeding with your gauze. If it's in their arm, if it's in their leg, if wherever it's at, the first thing to do when they're bleeding is to put direct pressure with sterile gauze on the spot. Then you will, you would ask, I'm sorry, I zoned out. After you put direct pressure on the wound, you would interview the person. You would say, are you on any medications? You have any pertinent medical history? Do you drink? What was the last thing you ate? What was the last thing you drank? You would check to see their symptoms. Of course, you would ask them, what symptoms are you experiencing, like besides bleeding? If they say fatigue, they're starting to feel dizzy, that's common signs of losing blood. And if you start to notice physical signs such as them being pale or the skin changing color, you would feel for circulation where the wound is to see if it's pale, because if it's pale, there's no circulation. If it's warm, if it has color, you have some circulation. So you would check for all that. You have to conduct a head to toe. So basically, start with the head. You would ask them first before you even do the head to toe, is it okay if I check you for any other signs of injury or illness? If they say yes, you go ahead. If they say no, that's when you just administer whatever they need to stop bleeding. But in this case, they said yes. You check their head, start the head, then neck, shoulders, then you go to the chest and abdomen. Chest and abdomen. You look for any signs, physical signs of trauma, anything like that. Any more bleeding from anywhere, maybe they have more than one laceration, one way they're bleeding. Your hips, legs, and then feet. After you do the feet, then you check the arms, obviously, any signs of anything else, other injury. You gotta check for circulation, like I said before, beyond the injury. If you see that maybe beyond this point there's no circulation, maybe they cut their arm right here, and right here you would see if there's any circulation. Might be warm. If it's warm and it has color, you got signs of circulation. If it's pale, it feels cold to the touch, you would notice that there's not really any circulation there. So that's when you would start accounting for things like that. That's when you would apply the bandages. If you did bleed through the first bandages, however, you would apply another one. The first gauze, you would take it, apply the other one. But in this case, you have the bandage, it did not bleed through. So you would then take rolling gauze with one hand. Let's say this is my victim's arm, or actually make it easier, say this is my victim's neck. One hand, you keep the gauze in place so it stays there. You start with the rolling gauze and you wrap around and you keep going around. Make sure it's not too tight, but make sure it's tight enough to actually stay in place and keep the wound pressed down and pressure on it so the bleeding can't stop. And if it's too tight, you'll notice that's when the circulation's cut again. So let's just say again, this is my patient's neck. If I wrapped it around their neck and I notice their neck's turning pale, say there's someone of my complexion, their neck is turning pale and it's cold, it's starting to get cold, and I know I've wrapped the gauze too tight. So I would have to readjust it or maybe reapply it at this point because it might have bled through. But at that point, if it's wrapped to perfect, I guess, tightness, then you would either use a tape or try to tie it so it can stay in place. That's when you would wait until EMTs come. You would monitor the victim. If they can't get to their back or they can't, try not to have them moving too much because that can affect how the wound does bleed. But if they can, try to get them upright. You want to make sure their back is towards something solid so they're sitting upright, or make sure if they're on the floor that they're in a comfortable position for when paramedics come, they're not in too much pain. But yeah, that's basically it.